This is breaking news.
Governor Kathy Hochul is giving an update on the coronavirus pandemic in New York. Let's go to it now.
Very, very good news is that the FDA just authorized Pfizer boosters for 16 to 17-year-olds. Therefore, I encourage everyone, first of all, get the vaccine, but also now that we have a broadening age group for the booster, it's really important that millions of teenagers will now be eligible to get that extra shot. They should. Let's do it before the holidays. Let's get it done. I also want to and that's why I have Dr. Bassett here, because there's still a lot of questions about the Omicron variant, and we have right now 20 confirmed cases in the state of New York, one in Broome County. I spoke to the county executive recently about that situation. New York City has 13, Oneida has 2, Suffolk has 3, and Westchester has 1. But however, we expect these numbers to continue to rise, and at this point we are prepared to say what we have is community spread. It is not coming from people who have traveled. It is being spread in the communities. And so we are watching what has happened in other countries where this first originated. It spreads very quickly. And we are still monitoring the situation. I'll have the doctor speak about this, but I want everyone to know that we are prepared for this. We are working very hard to make sure we have all the tools at our disposal, as I've mentioned. And at this point, I want to make sure that everyone has our updates. I'll talk about them in a couple minutes. But Dr. Bassett, would you please address the variant and also what we know and any information coming out of other sources? So, Dr. Mary Bassett.
Thank you, Governor Hochul. As you've just said, we've identified 6 additional Omicron cases in New York State. So we have a total of 20. They're mostly from the New York metropolitan area, but they come from all over the state. They have come from also the southern tier and the Mohawk Valley. And as you've said, Governor, this is consistent with community spread. We have over half of states reporting Omicron. It's been reported in nearly 60 countries. And we know that in this state there are more undetected Omicron cases, and as there are also in the rest of the country. But I do want to stress that the uptick that we're seeing in cases and in hospitalizations reflects the Delta variant. It remains overwhelmingly the dominant strain in the United States and, in fact, around the world. And we don't know yet whether Omicron will outcompete Delta. So we are still learning. We are lucky in New York State to have the internationally recognized Wadsworth Center Lab, which conducts sequences of COVID-19 virus samples. They ask other labs to submit samples to Wadsworth that have a characteristic PCR pattern that's called the S-drop. That's associated with the Omicron, and they also sequence a sample of a random sample of other strains of other samples. So this is important because we have reports that not all of the Omicron sequences contain this characteristic S-drop signature. So we are assuming that this variant is circulating around the country, and that enhanced surveillance is appropriate. There are at least 3 questions about Omicron to which we all want answers, which we are too early to answer with certainty. The first one is whether it will prove more transmissible than the Delta variant, whether it will cause more severe disease than the Delta variant, and how well our vaccines, which were developed for the original strain, will protect against the Omicron variant. So we're going to know more. We're learning more. So far, we know from looking at where Omicron is circulating in other countries that it seems to be highly contagious, that it is no more lethal than the Delta variant, and that vaccines continue to offer protection against severe symptoms and hospitalization. So while we are looking at this Omicron variant, we're also thinking at the department about the broader health impact of the COVID and looking at long haul COVID, children's mental health, which, for example, we've all noted recently has been so adversely affected. So we're interested in taking a broad approach to COVID. There are other things for us to be concerned about than the emerging strains as we think about the consequences for this pandemic on the residents of our state. We're working with all levels of government, with federal, state, and local parties. I'm particularly happy about this governor. We've worked to reestablish, whatever you want to call it, daily working connections with our colleagues in the New York City Health Department, with whom we are communicating frequently. I know that the world is weary of COVID. We are all weary of COVID. Fortunately, as new variants emerge, we have more advance warning than we had when COVID first made its appearances on our shores, when our federal leadership was looking to the east and New York City was the place that got slammed. We now know that we have tools. And before I turn it back to the governor, and I know, Governor, that this is what you always tell us, but I'm going to add my voice to it. We want people to get fully vaccinated. If you're fully vaccinated, we want you to get a booster. You've heard that we are now expecting soon for the CDC to recommend boosters to the 16 and 17-year-olds. The best protection that children have is that every adult around them is fully vaccinated. So not all children under 5 can't get vaccinated. Let's put them in a circle of protection in terms of adult vaccination. We wear a mask. Masking indoors is a good idea. Get a flu shot. We're in flu season. Think carefully as we go into the holiday season about crowds. Stay home if you're sick. So we simply must use these tools. Our physical and our mental health depend on it. So as we prepare for the holidays, I want to encourage everyone to plan around the most vulnerable person in their family unit. If it's a child who's not eligible for vaccination, look at your plans from the perspective of that child. If it's an elderly parent, my mother is 93, look at your holiday plans from the perspective of that person. I continue to be very hopeful as we face 2022. I'm hopeful not only for my hometown, New York City, but for the whole state, upstate too. I can't wait to get back to Albany, actually, where I'm living. And I want to urge everyone to remember that vaccine is how we protect ourselves. Masking is how we protect each other. I want everyone to be safe, be smart. We're in this together. Thank you, Governor.
Thank you, Dr. Bassett, for embracing the leadership role in which you've been entrusted. There are 20 million New Yorkers looking to you for the guidance to help us navigate through these turbulent waters. So great to have you as a partner, and put an exclamation point on every point you made. And just, I do want to see this in the Newsweek article. Just remind everybody who's filling up the hospitals. 10 times more likely to face hospitalization if you're unvaccinated, and that does not have to be. We understand that. I did want to give an update. I was on a call this week with the White House Coronavirus Response Coordinator and the national governors, and as well as when I was in Washington a week or so ago, we had conversations about this, and reinforcing that the dominant strain still is Delta, and we are very, very focused on making sure that people have the ability for in-home testing. We're talking about the fact that the federal government has quadrupled the availability for at-home testing, meaning they've approved, I believe it was 13, and previously have been 8 manufacturers of this, so there should be more supplies on the shelves, and that it continues to drive the price point down, which is also good news. But that, as I had previously announced, private insurance companies are now required to cover the cost of your test kits. We're trying to alleviate any barriers to people getting those test kits, especially for children. So we're going to continue partnering with the federal government. These updates are very helpful for us. And I do want to thank President Biden and his administration for their enlightened leadership as we continue to work through what we anticipate is going to be a very challenging winter time. We were very concerned that we have enough testing kits here in the state of New York. We've ordered an additional 1 million test kits. They should be coming mid next week. We'll be getting those out to the counties. I want the county health departments to be ready for this. And it is our desire that these go into schools, that they work closely with the school districts, particularly in cases where someone is tests positive in a classroom. We want children to be able to get back in the classroom, test to return, because as Dr. Bassett mentioned, there are still collateral mental health impacts from the time when children were isolated, learning from home, but it's not any better for them to go to school and have to be sent back because there's a positive case. And we want to make sure that we restructure this and give parents what they need and get these to the schools, to the parents, so we can get kids back in school as soon as possible. Huge priority of our administration. And these test kits are good for up to 6 months, which is really important. So we're getting them out to schools, getting them to the counties, and having a very strong dialogue with our partners in education as well as in local government. Let me show you some of the cases here. We are looking at 34.6 per 100. There was a time we used to just tell you the percentages. And the reason why the percentages, it used to be 1% New York City and Buffalo might have been 7 or 8% or higher. The reality is that this is a more accurate representation when you look at the cases per 100, because per 100,000, actually per 100,000. We don't have a good handle on who is getting tested, especially with now the advent of home testing kits. We don't know if someone's testing at home or getting tested at work. So at a time when we used to be able to track all those, we had a better idea of who was actually being tested. We could put forth a realistic number that showed the positive cases. And in light of how the testing opportunities are more diverse and spread out and not necessarily managed as well, we want to make sure that we're using per 100,000 cases. So 2 weeks ago, we were at 34.6 per 100,000, just so you have context. We're almost 50 now. So literally in 2 weeks, we've made that major jump. And I want people to see the state as a whole to get an idea. New York City still being higher than it had been. It did jump. It had been quite a bit lower just a couple weeks ago. But this red is an alarm. This is an alarm going off as you see what's happening. Not unexpected. Everyone's seen the toughest states in America are all in the Northeast. No surprise. It's getting colder. People are staying indoors more, and that was actually foreseeable. We've been talking about that for a while. So we're not an anomaly, but it is not still a good place to be. Hospitalizations, this is what keeps me up at night. We continue to see an uptick in hospitalizations, and this is a trend. I think you can draw a direct correlation between vaccination rates in an area and the number of hospitalizations. And we know it's the indoors, the colder temperatures, but also the areas where people are more likely to be vaccinated. And certainly with the booster shot, those are not as high as the areas where people are unvaccinated. Therefore, this does not have to be, but look at where we were last April 2021 and how the numbers are spiking up as well. So we want to make sure that we're alerting people. This is not the sky is falling. I just want to make sure that people take this very seriously. So it is that increase in hospitalization results in what? Fewer beds and less access to critical services. And that is what's happening in at least 32 hospitals right now that we determined needed additional help. They had to suspend their health care. They had to suspend their elective surgery. So here's what we did. We first of all, to deal with anticipating that there would be a crisis along these lines, we did sign an executive order to expand the eligible healthcare workforce to allow more people to administer the vaccine, because at one time it was limited. We've expanded to EMTs and others, so we have a larger pool of people who can administer vaccinations. We're also allowing out-of-state healthcare workers and out-of-country to be able to come here, and are allowing them to practice here in New York State during this crisis time, allowing EMTs, as I said, midwives, registered nurses, physicians, and everyone else to administer the vaccine. Continue to deploy the National Guard. I've been receiving pictures around the state of the National Guard being welcomed into nursing homes. I wasn't sure what people would think about it, but the people are very excited about this. I even said that they need to wear uniforms because maybe it looks a little intimidating, and apparently they all feel very secure when they see someone in uniform walking down the hall. So that's been an interesting dynamic I didn't expect, but I wanted to make sure that we used all of our resources. The reason they're in nursing homes, as I mentioned before, that there's a backlog of people who should be discharged from hospitals who cannot go to assisted living or long care programs or nursing homes. So we had to help with the staffing there because we have shortages throughout the entire healthcare system, but we took a proactive approach to help them as well. So our hospital update, as you know, today is the day. We said that elective surgeries would be suspended if any hospital was not able to increase their bed capacity. We gave plenty of notice. We wanted people to make necessary steps, activate their surge and flex plans. And right now we have, as I mentioned, 32 hospitals affected by that. I want to make sure that people understand two things. One is that we're going to reassess this on January 15th. I don't want to give long-term changes in protocol and requirements without an end date or at least a time that we're going to reassess. So on that date, and leading up to that, we'll have a better sense of whether or not we got through this surge and we don't have the increase in cases we fully expect, and how we manage them and how the hospitals are doing. And we want to be flexible as the hospitals can step up above those threshold of having more than 10% bed capacity. We want to be flexible, we want to be reasonable, and not have a top-down only approach in this space as well. Hospitals have been through a lot in the last few years. Also reminding people what's still covered. We want to make sure that people do get preventative and certain diagnostic procedures still taken. So I've listed a number of the illnesses and conditions: cardiac, limb-threatening vascular procedures, dialysis, cancer, diagnostic. So you have a whole list there. That's important to get out to people, that those are the areas where they do not have to suspend elective surgeries. So our Department of Health keeps working with the local health departments to work closely to bring elective surgeries back on at the appropriate time, and we expect to get there. Again, a preemptive strike, make sure we have capacity. Hospitals already don't have capacity in certain areas. Some had already suspended elective surgeries, but some did not, and we feel that this is the right correction at this time. So we have an increase in people getting vaccinated. We know nearly 92% 18 and older have had at least one shot. That is phenomenal. And a good news to report, we were very concerned initially that the children from ages 5 to 11 were not getting fully vaccinated at the rate we wanted to see. The first wave of kids have now received their second dose, and many are fully vaccinated. And these aren't great numbers, but it's going right. Last week it was 0.5% of children in that age group were fully vaccinated, and now it's 5.8%, a 5.3% jump. That's good, but we have a long way to go there. That's some progress, but I'm very focused on these children getting the vaccinations. I do want to talk about some areas that are doing very well. I want to give a shout out. I mentioned the National Guard earlier. They are running our statewide Albany Crossgates Mall vaccination site, which is right near the hotel I used to stay in all the time, so I know this mall well. They hit a milestone, and they've had over 300,000 doses already, and I just want to give them a huge round of applause and shout out from here and thank them for the work that they're doing. It is people like this, and again, flashback into the past, there were so many people that we praised constantly, called them heroes, recognized them, and I just think that many of them are getting exhausted. They've been at this longer than they anticipated, so we need to continue to recognize them and honor them and thank them for the extraordinary service that they are continuing to do, including the men and women who are part of our National Guard. They're always there when we need them. We are opening more vaccination sites. We have existing ones already. Here's a list. We have brand new ones in Allegheny, Broome, Clinton, Cortland, Delaware, Erie, Fulton, Suffolk, and Yates. Again, this is in coordination with the local public health departments. This is not us telling them they have to have this. This is saying these are areas we can bring more resources, and these are the places that we're doing it already. So these are bases. Also, we've identified places that had outreach. We know the vaccination rates are too low, and they can continue to increase. I mentioned boosters briefly, but we've had a big increase in boosters. I think the Omicron variant got everybody a little nervous. They started realizing that there are some incidences of breakthrough with the original vaccinations, and so we've had nearly 500,000 booster doses just this past week, a 50% increase, which is really quite incredible. So we're proud of that. Here's our booster map. You can see the numbers going up all over, and let's keep it going all over the state. This is our key out of this. Schools. Right now, only 20% of 5 to 11-year-olds are vaccinated. What I referenced before was those who've already been fully vaccinated. We're continuing to gather data from the school districts. We're letting them know we want this to be increased, and we're requiring all schools now to issue a vaccination survey to parents so we can find out what's going on. Tell us where parents are And if they're not able to access the vaccines, we want to get them in schools as often as possible. Are they going to their children's pediatrician? Are they going to the local pharmacy? We want to know what's going on, get a better handle on the numbers, and work with our local county health departments to target the high need areas that need additional support. So we're continuing our incentives. We're doing everything we can. I will also say that I'm in conversations with businesses right now about some other steps we're going to be taking, but I'll say more on that tomorrow. And right now we have some more incentives. We have our scholarships. I'm not sure why anybody wouldn't jump on this one. It was so exciting when I was able to call the winners. Some are even 8 years old, and 10 years from now they're going to get a free ride to college. You know what the cost of college might be in 10 years? This is incredible. NFL gear and hunting licenses, fishing gear, ski lift passes, but we want to be even more proactive on that front. And with that, I'd like to bring up my Lieutenant Governor, Brian Benjamin, to make another announcement here. And here's something that we're very excited. Brian Benjamin, come on over here. We also know that it's the holiday season, and you cannot be in New York City in particular without thinking about the Rockettes, Radio City Music Hall, and talking about a brand new incentive. We have the first 50 people at these sites listed here: Yonkers Library, Brooklyn Christ Fellowship Church, Mount Vernon Grace Baptist, Freeport Bethel, and as Queens Museum in New York City. The first 50 people will be able to get free tickets. This is in partnership with MSG and Radio City Rockettes for the holiday season, and we look forward to them getting. These are people getting boosted. Okay, this is our booster incentive. So we want to make sure people know that there's an incentive. Come on in, be vaccinated, be boosted, and you get a free voucher for the Christmas Spectacular Show at Radio City Music Hall. And at this point, I'm going to turn it over to some individuals who have a few words for us. Hello.
Hi.
Tell us what you're doing.
We are so excited and proud to partner with Governor Hochul to get the word out about getting boosted. If you head to any of 5 select sites and are one of the first 50 people to do so, you'll get a voucher for 2 tickets to come see us before Christmas.
We all want to get back to normal life here in New York City and everywhere, and the way that we can do that is through vaccinations and boosters. We want to thank Governor Hochul for her leadership and getting New Yorkers vaccinated and boosted. And we're always here to help. Make sure you come see us, the Rockettes, at Radio City Music Hall from now until January 2nd.
Thank you so much. Look forward to seeing you out there. Let's keep it going. That was fun. I also want to make sure that we acknowledge an important date here today. And it is the birthday of our Lieutenant Governor, Brian Benjamin. So I want to recognize him. I was baking this last night in my hotel room, so there you go, Lieutenant Governor Brian Benjamin. Here you go.
Thank you so much, Governor.
Like to say anything? Yeah. I also want to tell everyone, if you don't see him next to me, he is likely to be all over the state. I said, you're going to do exactly what I did. But also, he is going to vaccination sites, and I want to thank him for going into all communities, particularly focusing on communities of color, to remind people how important this vaccination is. And Lieutenant Governor, if you'd like to give an update on how those journeys are going and what the reaction has been, I'd really appreciate it.
Sure. Thank you so much, Governor Hochul. I mean, this is the kind of governor I like. Happy birthday cupcake. Let me put this down. Very briefly, it has been an honor to be traveling the state, particularly going upstate, to go and talk to some of our young people, particularly in communities of color, who have shown some hesitancy. We are finding that young black men in particular, whether downstate or upstate, have been more resistant, and there are some work we're looking to do on that front, working with pastors and community leaders to figure out solutions that can work, but it's definitely something that we have to address. Secondly, as I've seen in my last trip to Syracuse, Rochester, and Buffalo, a number of our communities that are more Republican leaning, there has been a lot of resistance as well. Some of it has been politically driven, and one of the things that we would like to try to do is to find ways to have conversations to take the partisanship out of getting vaccinated, wearing masks, and keeping us all safe. So thank you, Governor Hochul. And there was a lot of excitement around bringing the National Guard to help with some of the hospital capacity issues, particularly in some of our hospitals upstate that have significant capacity issues, over 100% capacity, and they really needed that help. So thank you, Governor Hochul. I was asked to bring that message to you from a number of our hospitals and nursing homes. So thank you very much.
Thank you, Lieutenant Governor. And
Now, or should I wait?
you're going to split that with me. So at this point, we know the tools. We know what to do. We have to get tested, stay home when you're sick, wear a mask indoor public places, wash your hands. As I mentioned, I will be making an announcement tomorrow about some policies that we think will be important to help fight this impending surge. And that's exactly what's happening at this point. We've seen the numbers. We've seen hospitalizations go up. We've seen infections go up. And vaccinations are going up, but not at the rate we want them to see. So we've been talking about needing to take additional steps at some point, and we're going to be talking about that. I'll be releasing information on that tomorrow. So that's where we're at, my friends, and I look forward to taking any of your questions.
Governor, the State Attorney General Letitia James dropped out of the governor's race today. She was considered one of your most formidable challengers, second behind you in the early polls. What do you make of her dropping out of the race? And did the two of you talk to each other before she made the announcement earlier today?
The Attorney General did call me this morning earlier, and she let me know her intention was to remain doing the critically important work that she has undertaken in the Attorney General's office. And we have crossed paths many times before and after my ascension to the governorship, and I want to thank her for her leadership. Even last week we were together in a Brooklyn church, always very cordial, always respectful to each other, and that's the hallmark of the two of us and how we plan to continue working together to support the important policies that she's undertaking and her support for what we're doing here in the state of New York. So all I can say is I respect her tremendously, always have, that it has never been not the case, and we are going to do great things. And I look forward to having her on the ticket as we head into the November election together. And all I would say after this is a very bad day for Donald Trump and the NRA. When we have Tish James, one of the finest attorney generals in the country, very focused on making sure that justice is done.
So you are supporting her re-election?
I support her re-election, yes.
While Attorney General James was still a candidate for governor, you had indicated, look, you've run 13 times before, you run hard, you were looking at a competitive primary. Would you describe yourself honestly today as relieved?
You don't know me. It has been a change in circumstances. However, I always, always, always run like an underdog. I'm a Buffalo Bills fan. I'm used to being an underdog. And in my mind, I'm down and I work hard. And that's been the hallmark of my success, is that no matter what a poll shows, no matter what the landscape looks like, that's why I've been successful. I take every election seriously. Unless everyone drops out, we will have a primary. I'm not expecting that. But I have said from the beginning, my focus has to be on the November election, because we saw the warning signs just recently on what can happen in places like Virginia and in places like New Jersey, which was very close, and what we saw in Nassau County, not far from here. I have been heeding that warning and focused on that as the leader of the New York State Democratic Party. It is also on my shoulders to pull it together and have unity in our party, because we have to make sure that the Republicans do not get a foothold anywhere among my colleagues who are running for office statewide. I have to protect the senators, the assigned members, and when I was in Washington, I said I'm also making sure that we can keep the House of Representatives in Democratic hands. I served in the minority in Congress a decade ago when the Tea Party ascended to leadership. That was not a good time for our country. And all we did was play defense, trying to stop policies that would be horribly detrimental to the country and certainly to my district in the state of New York. So that is our focus. It allows us to galvanize. So I think the Republicans will look at this as well as not a good development for them as we march unified all my colleagues running statewide and up and down the ticket, including our members of Congress, and I'm going to continue to fight for them as well. That's what I've always done, always support other people, and I embrace the leadership role that's been entrusted to me, and I'm honored to serve as governor and look forward to serving, running together with Attorney General Tish James.
Could we ask a few COVID questions, if you don't mind?
That'd be great.
You talk a lot about your and your administration's efforts to combat coronavirus, including a variety of incentives, particularly for the booster. Would you talk a little more, though, about efforts that people need to take for themselves and how you might encourage them to do so other than incentives, maybe even mandates? And is that what you might be referencing for tomorrow?
I will say I'm referencing that I'm having many conversations with people today in anticipation of a very challenging season coming up with the holidays. So yes, stay tuned.
Hello, Governor. Good afternoon.
Good afternoon.
We're going to jump over to our Zoom questions now. Your first question comes from Bart Jones of Newsday. Bart, your mic is open.
Hi, Governor. Can you hear me okay?
Yes, I can.
Good. So, listen, as we look across the state, we see that the region with the best performance of all on COVID-19 today, believe it or not, is New York City, which was once a global epicenter of the pandemic. Now the city has the lowest positivity levels in the state at about 2%, even though it's a densely populated urban area, obviously. Suburban Long Island, by comparison, is 6%, and some regions upstate are even at 10%. Long Island is now producing almost as many daily cases of COVID-19 as New York City, even though the city has triple the population. My question is, why don't you use your emergency powers that you assumed on November 26th to implement statewide the same program New York City is doing? As we know, in the city, people have to show proof of vaccination to get into restaurants, sports venues, gyms, etc. No other region is doing this. Now, I know you've said you're leaving it up to local governments to decide how to handle the pandemic, but none of them are deciding to follow what New York City is doing. Is it not irresponsible not to implement this plan statewide when we know it works?
As I said, the plans are being developed to address the impending surge. And I've said all along, I'm watching the numbers. The hospitalization rates are the number one issue I look at. And we've taken very bold steps to help the institutions, the hospitals, and the nursing homes already. We do have a statewide vaccination mandate for healthcare workers, which was not necessarily popular, but it was the right thing to do. We enforced that. We do have a statewide mask mandate for children in schools. That's been very effective. And I will tell you that my team is working around the clock to address exactly what you're looking at. I know the numbers. I know them like the back of my hand. I know exactly what's happening. And we're preparing to take steps to assist regions of our state. And I do commend the county leaders who've appreciated our approach, which is to empower them. But I've always said I will continue to reserve the right to take other steps if necessary. And the numbers right now are not looking good.
Thank you, Governor. Your next question comes from Bernadette Hogan of the New York Post. Bernadette, your mic is open.
Hey, Governor, how are you? Thank you for taking my question.
Sure.
Wondering, there are representatives from the law enforcement community up in Albany today, and they are calling for amendments to the state's bail laws, one of which is they want to completely eliminate cash bail and also allow judges to consider a dangerousness standard. Wondering if you support that, what you think of that, and will that be a priority for you in the upcoming budget process?
Public safety is a huge priority of mine. Everyone knows that, and I'm looking forward to working with Eric Adams and our members of the legislature to come up with the right solutions to protect public safety. So we are looking at everything. And that's where I'll leave it right now, Bernadette. Everyone knows I don't make policies standing from the lectern, but it's something that we've been keeping a close eye on and making sure that people feel safe and secure in the state of New York.
Governor, your next question comes from Michelle Bocanegra from Politico. Michelle, your mic is open.
Hi, Governor. Can you hear me?
Yes, I can.
Great. Just so two quick questions for you. I just wanted to get your thoughts on Chancellor Malatras's resignation this morning, as well as a report from the New York Post that you had placed a call in to Chairwoman Meryl Tisch, saying Malatras should leave his post. I understand that you have been reluctant to publicly weigh in on the issue, but do you think that your thoughts on the matter had any influence on the Chancellor's decision to resign? And then a second question I was hoping to address to Dr. Mary Bassett. You mentioned that the state DOH was hoping to widen the lens on COVID by looking at things like children's mental health. So I just wanted to ask, what are you considering in terms of moving forward with that? Will you, for example, be issuing guidance to schools in that specific arena?
Thank you. With respect to the first question, yes, I did have a conversation with Meryl Tisch last night. It was an important conversation to have, and it was focused on the future of the SUNY system and how we can ensure that we have the focus that we need, the undistracted attention on making this the world-class university system that it should be. And that was the context of that conversation. I won't say more about the conversation, but it was an important one. And with respect to not publicly calling out for certain things, I think people understand that the position of the governor is not to stand out and make proclamations and statements. I'm more inclined to work behind the scenes and focus on results. And that is what I'm going to continue to do. And I do thank Dr. Mary Bassett for assuming the responsibility, which we talked about a couple days ago, the responsibility of us to broaden our approach to dealing with the effects of COVID. And she is very concerned, I'll let her speak for herself, about the impacts on the mental health of our children in particular. But I also asked her, as the epicenter of the pandemic in March of 2020, we still have probably more long-haul cases than anyone else in the country. This was so widespread. And I want to make sure that we're addressing those individuals who still are dealing with, whether it's still being excessively tired, or those individuals who have lost their sense of taste or smell months and months later. I mean, I'm speaking about individuals on my own staff who've been affected. So I want to thank her for that, and if she wants to address this, or certainly should be making announcements as it unfolds. Okay. And I thank her for using the resources of the finest health department in America to help not just New York address these issues and find answers and hopefully solutions, but also to be a leader for the rest of the country.
Thank you, Governor. Thanks for that question. Obviously, the number one thing that we're concerned about doing is keeping children in school. And part of that is promoting vaccination. But in addition, we know that now we're in our second year of children having their education disrupted. And we know that this has had huge mental health effects. I'll be having a conversation with the state education commissioner, and we'll be thinking about what we can do on this. So I can't tell you a particular plan, but I just want you and the public to know that we're focused on boosters and vaccination and keeping people safe in that way. But we understand that there are other ways in which people have to be kept safe, and that mental health is just as important as physical health. On long COVID, we're going to be convening. That's one of the immediate roles that the health department can play, is as a convener of researchers. And we, of course, have huge access to data. So we want to see how we can use the resources that we have as a center for a very widely recognized biomedical research establishment in New York State, and as a department that has huge amounts of COVID data, to see what we can do to better understand long-haul COVID. I just want to remind people that not getting hospitalized or dying of COVID is certainly something that is very important and a good reason to get vaccinated. But getting infected is not always going to end in a happy way, and that's why we need to understand long COVID better. Thank you, Governor.
Okay.
Thank you, everyone. That's all the time we have on Zoom today.
Okay. Thank you, everybody. Appreciate you coming out today.